Welcome to Medically Speaking, a UCLA Health podcast hosted by me, Dr. Eve Glazier. March is Colorectal Cancer Awareness Month, and today we have an extraordinary guest, legendary journalist, best-selling author, and passionate health advocate, Katie Couric.
Oh, thank you. Thank you. Hi, Eve.
Katie, we are beyond thrilled and thankful that you're here. You really don't need any introduction, but please let me just sing your praises for just a moment. You became a household name from your award-winning career as an anchor on the Today Show. You're the founder of Katie Couric Media, the publisher of the Wake Up Call newsletter, and host of your own podcast, Next Question with Katie Couric. Your amazing, impactful advocacy work includes co-founding the National Colorectal Cancer Research Alliance and Stand Up to Cancer. And your very pivotal role in Find It Early Act has really increased awareness and accessibility of cancer screenings. And Katie, on a personal note, I just have to tell you that my Roman Empire is when you aired your colonoscopy on the Today Show.
Thank you.
Why don't we get right into it and start with the importance of screening and early detection? You've shared that you felt really lucky until you turned 40, which was when your husband Jay was diagnosed with stage 4 metastatic colon cancer. But then more recently, you described your own breast cancer diagnosis as fortunate because modern medicine was able to detect it early, enabling treatment and cure. Can you share with our listeners why screening for cancer is so crucial even before symptoms appear?
Absolutely. First of all, Eve, so great to be here with you. Thank you so much for having me. And I'm so delighted to help bring attention to the great science and work that's being done here at UCLA. Screening is everything. It seems like such a no-brainer, but getting people to actually adhere and comply with screening guidelines is sometimes challenging because I think psychologically we don't worry about things until they're right in front of us, until we experience them. I think that's true with all kinds of things, whether you're talking about climate change or your own personal health. It's hard for people to see into the future. And so screening is so critically important because it can stop cancer in its tracks. Not always, and there need to be better screening mechanisms for all cancers. For example, I know ovarian cancer doesn't have a great way to screen and detect it early when it's still treatable. Similarly, pancreatic cancer. So there are cancers where I think we need to really focus on early detection. And I know scientists everywhere are really trying to fix that. But with certain cancers like breast cancer, for example, or colon cancer, and Eve, you can tell me other kinds of cancers that have early detection modalities. I think sometimes with thyroid cancer, right? You can find it early. Esophageal cancer, I think, is harder, right? But there are certain cancers like breast and colon that have screening techniques and they can be found before they become a problem. You know, the colon is this very interesting part of your body where it's like can keep cancer at bay and almost in this kind of casing, if you will. I don't mean to be like weird and graphic, but if you can detect a polyp that has the potential to be cancerous or even a small cancer that hasn't permeated the colon wall, and you can remove that is in essence curing the cancer.
Absolutely.
Because it hasn't had a chance to go through the lymph nodes, which are really the gateway to the whole body, and create a problem where you have the cancer, microscopic cancer throughout your system that has the capacity to metastasize on an organ, another organ like the liver or the lungs or the brain. And so if you can detect these cancers early, and in my case, I had stage 1B breast cancer. It hadn't gone into my lymph nodes. I had a lumpectomy and radiation, and hopefully that will eradicate the cancer from going through the rest of my body. It's just, it saves your life. I mean, it's as simple as that. Early detection saves lives. I don't know how to put it any more simply than that. And that's why screening is so critically important. And, we can talk about screening guidelines and whether the age needs to be lowered. I'd love to hear your views on that. But right now, if you get screened for breast cancer or colon cancer and it's found early, your potential to lead a long, productive life is high. And if you're not screened and the cancer has a chance to grow and develop in other parts of your body, unfortunately, that's when it's much more difficult to cure.
I mean, obviously, I could not agree more. I mean, screening saves lives, and I really want our listeners to hear that.
And a lot of people are like, oh, it's a pain, or they put it off, or,
yes.
It's not at the top of my to-do list. Or another oft-quoted misconception is, I don't have a family history.
All the time.
And
all the time people
I
say
think
that
people don't understand that at least 70% and maybe even 75% of colon cancer cases have no family history. And I always say no family history is no guarantee. My husband, Jay, didn't have a family history. Now, his mom had ovarian. His grandmother had breast cancer. So perhaps there's some kind of glandular adenocarcinoma gene in his family that's yet to be discovered. But no family history is no guarantee. Similarly, I think something like 80% of breast cancer cases have no family history. So I always say your family history could start with you.
That's exactly right. And I think that's exactly the message that we want to get out. Another thing that my patients, my friends, my family members even say, sure, I don't have a family history. Also, I feel really good. Like my poops are great. I eat all my kale and I eat well. So why would I even need to be screened? And so what would you say to them?
Well, I'm glad they're staying healthy. I'm glad they're eating well. I'm glad their poop looks good. But I'm very happy for them.
And they can post it on Instagram.
But the problem is that for many of these cancers, they are silent killers.
Yes.
You don't really have symptoms until the cancer has become a bit of a problem. So you cannot guarantee that a healthy lifestyle will prevent you, sadly, from getting these diseases. So, oftentimes if you have the symptoms like rectal bleeding or irregular or a different look in your bowels, your bowel movements, I guess I can say, if they've changed shape, size, or color. Sometimes I think also people misunderstand what it means to have a fecal occult blood test. Have blood in your stools, because it doesn't mean you're going to see red in the toilet bowl. And I know this is like not super appetizing for people, but let's be honest. As a children's book says, everybody poops, right?
One of my favorites.
And so, sometimes it's just like having very dark stools because the blood has darkened your stools and it's not readily apparent in the toilet bowl. If you have unexplained weight loss, fatigue, bloating, things like that. But as I said, that's often when sadly the cancer has advanced. So you could feel perfectly well. You could be running a marathon. You could be eating well. You could feel like you're in tip-top shape and have tons of energy. And you could also have the beginning of colon cancer.
That's exactly right. And that's exactly what I try to convey to my own patients. I think people are expecting almost like there to be a little flag in the poop that says, hey, something's wrong. But it's not like that. It can often not be that obvious, which is good because we want to catch it when you don't have symptoms.
Right.
Because as you said, early detection. So, getting screened, having that early detection significantly improves survival rates and really, really makes treatment much more effective.
It's the difference between life and death.
Let's face it. It is. And something you're saying too about, sometimes you'll Google or come to UCLA Health and, you look at all the typical signs and symptoms. But I think a really important point is knowing your body. So if something changes, pay attention to it. If you don't feel right, pay attention to it.
Right. And if a doctor doesn't take you seriously, find another doctor.
Or break up with your doctor and find another one.
Yeah. And we should talk about, I think, screening guidelines, because I think it was in 2021.
Yes.
The age was lowered to 45.
Yes.
It used to be that you needed to get a baseline colonoscopy at 50 years of age. But because they were seeing more people being diagnosed, it was always 45, or has been for quite some time, for Black men and women.
That's right.
But because younger and younger patients, and we'll talk about this in a minute, Eve, because it's so important, we're seeing getting it at an earlier age. It's now 45. We have to get the word out, because only 20% of people between the ages of 45 and 49 currently get screened. And so everyone needs to know that it's 45. Now, Jay, my late husband, was diagnosed when he was 41. And I remember when this happened that 13,000 people under the age of 50. Now, this was in 1998, so I'm not sure about the updated numbers. And I think they're higher now because we're seeing more incidents among younger people. 13,000 people under the age of 50 were diagnosed with colon cancer every year. It might have been even died of colon cancer every year. We can even check these stats.
Sure.
But I thought, well, are these just disposable people? I mean, what about these people? And I think we need to start talking about the people even under the age of 45, because we've seen a dramatic increase in colorectal cancer cases in people in their 20s, 30s, and 40s, which is really scary, and early 40s, before the recommended screening age. And this is such an interesting topic to me, because they're really trying to figure out why this is happening.
That's right. And we've had many conversations, even with our own scientists, about why is there this increasing incidence of younger people. My best friend was also diagnosed at 42. And, so again, she didn't miss a screening. The guidelines hadn't been changed yet. But even so, she was only 42. So
what stage?
Stage 4. So, and
that's so heartbreaking for me to hear.
It's very heartbreaking, but it begs the question that there can be guidelines, but we need to do much better with acknowledging that there's this rise. I mean, a really terrifying rise. Yes, is it the gut microbiome?
Yes.
Is it the environment? Is it diet? But I mean, why? Because unless we can find out why, then we can characterize actually figuring it out.
Exactly. And there are a lot of theories. I find this super interesting. I mean, one is ultra-processed foods.
Yeah.
One is microplastics. I mean, again, these are things people are looking into. There may be there's correlation, but not causation, right? Is that what you doctors would say? And some of them are just that, theories, but ultra-processed food, microplastics, there are also questions about the overprescription of antibiotics for viruses that may not need them, might be altering the microbiome. I just did a panel on this at South by Southwest with some microbiome experts and the head of early onset colon cancer, the program at MD Anderson.
Yes.
And she was saying, and both experts were saying, that a lot of the people who are coming in with colorectal cancer are healthy, super healthy, like your friend
super healthy.
Hale.
Yeah.
They're marathon runners. They're in incredible shape. They're not obese. And one area which I thought was super interesting, and again, it's just something that they're looking at, is protein that's not naturally occurring, because a lot of sports people and runners are eating these protein bars,
right,
which
and
are
drinks,
super high in protein and protein powders and all that stuff. I'm going to get sued by the protein, like the unnatural protein industry or something. But they're wondering if there's some kind of connection, because as I said, people who are using these as meal replacements, and they are being marketed as super healthy, but they are actually ultra processed as well. So I think this needs a lot more epidemiological studies. The problem is that these epidemiological studies take a long time to conduct, and they're really hard to do. But I think one thing is and alcohol.
Yes.
People are looking at alcohol too, is to really stay away from ultra processed foods and eat as naturally as possible. And, remove anything. I think Bill Maher did a segment on this, Eve, and he said something like the average person ingests like 2 credit cards worth of microplastics a year. And I was like, what?
Yeah.
So, think about, the containers and how you're cooking food and the cutting boards you're using and, do everything you can. But you're right. Until we really get to the bottom of this, it's hard to say why this rise is occurring. I don't know if it's some people have even suggested, I don't know if you read the Time magazine cover story on this, that maybe the light from our devices is having some kind of impact. So we really need to focus on studying this more.
We do. And in the meantime, maybe even lower that screening age.
Right. I know. And that's when you get, you're a doctor, the risk-reward ratio, right?
And all the organizations and...
and the cost of screening. Yes. And that's why I'm really excited about the future of liquid biopsies.
Yes.
But they're a long ways away. And before I even suggest like how exciting that is, I'm always afraid that people won't take advantage of the diagnostic tools they have now. Right. So that's something we can think about in the future. And then younger people, can be part of their annual physicals, which are blood tests basically to find out if cancer cells are circulating in your bloodstream. But those are really early days.
But I look forward to that because, if we don't know the why, we're going to certainly have to address the what.
Yes.
So, speaking then of, diagnostic and screening tools, I also remember when we first met, people probably ask you all the time, should I get a colonoscopy? Should I do the FIT test, which is, putting stool on a card and looking for DNA or blood in the stool? Stool meaning another word for poop for our listeners.
Yeah.
But I remember what you said, your philosophy and thoughts about getting which screening test.
Yeah. And what I always say is the best test is the one that gets done. Colonoscopies can be expensive.
Yes.
If you don't have insurance, it may be difficult, although after my husband died, my sister, Emily, who was a state senator in Virginia, and who tragically was diagnosed with pancreatic cancer just a couple of years after Jay died, she got legislation passed in Virginia that required insurance companies to cover screening colonoscopies for anyone 50 or over. And I think a number of states have followed suit. But, insurance can be tricky. I think Obamacare actually covered, preventive screening, which is great. So hopefully the Affordable Care Act will not be rolled back. But let's say you can't take the day off. Let's say it's hard for you to get childcare.
Right.
Let's say, you don't have someone to pick you up after the colonoscopy.
It's a big barrier.
So, I work with Exact Sciences and they started Cologuard. And so that's covered by insurance. And it's probably not the gold standard that colonoscopies are, but it really has a high rate of detecting colon cancer. You can't necessarily find a precancerous polyp in a Cologuard stool test, but it's easy to do. It's covered by insurance, and it's a great step. And if it shows it's positive, you obviously have to get a colonoscopy, but it really helps this larger population figure out if they need to get additional screening. So I'm all for it.
I think that's the best advice. It is a great step, and it also hopefully then lends itself to more conversations and more awareness, especially with your provider. You're reminding me that there's still so much stigma about getting colonoscopies and even embarrassment when we're discussing, our bodies. I'd love to hear your thoughts about how do we normalize those conversations?
Well, I think that's one of the reasons I got an on-air colonoscopy on the Today Show. People often mistake it and say it was live, and I say I'm not that brave, but we taped it. But one of the reasons I wanted to demystify and destigmatize this life-saving procedure, I think just talking about it, talking to your friends, making sure everyone listening, if they're not 45, now they're aware of the symptoms. Anyone they know who's 45, tell them, hey, I love you. You need to get screened for colon cancer. I don't think people realize that women are diagnosed as often as men.
Yes.
I don't think they realize it's the number 2 cancer killer of men and women combined.
Yep.
I don't think people realize how preventable it is. And I always say, I don't want you to be the person who says, if only I had gotten screened. And I hear stories like that all the time. So I think conversations like this, it's funny because I remember in Sid Mukherjee's book,
Yes,
The Emperor of All Maladies, which is, he won a Pulitzer Prize, and I know Sid, he wrote about how in the 50s, if you wanted a support group for women with breast cancer, in the New York Times, you couldn't say breast cancer. You had to say cancer of the chest cavity.
Unbelievable.
And I think that for so long, cancer was so taboo because it was so scary for people. And now I think people share everything. And colon cancer should be one of the things that we talk about. And I think it's become a lot less stigmatized, I hope, since I've brought it out in the open. I think Ryan Reynolds got a colonoscopy. There are people who just, I think, appreciate the fact that if you're lucky, the vast majority of people have colons, and you have to keep that part of your body healthy, just like every other part of your body. So it's nothing to be squeamish about, and we just need to bring it out in the open.
I couldn't agree more. I lost both of my parents to cancers, and neither of those cancers have a screening option. So it's very personal for me, and I feel very compelled to tell my loved ones, my friends, here's a cancer that you can catch. Please go get screened. And then I step back and I acknowledge that screenings can also feel uncomfortable, right? Sometimes can be invasive, right? If you do have the colonoscopy, which involves
but it's really
long
good.
tooth.
It's a really good nap. Propofol is
the
really
best
good
nap
drug.
Let me just say that your couple's colonoscopy with your husband, John,
right.
your Propofol fist bump, I mean, I never stopped laughing. It's amazing.
But, you're right. I always say, yes, you're right to acknowledge that. Like, the prep is a pain. Who wants to pee out of their bottom? It's no fun. But I always say it's kind of like a colonic. So you can think of it as a cleansing. And it's much better, infinitely better than being diagnosed with colon cancer. So it's like, stop whining, buck up, just deal with it, get screened. But I think I was awake and semi-lucid during my colonoscopy because I wanted to kind of watch and take our Today Show viewers through the process. But you are usually out like a light. You wake up and, that's one less thing to worry about. And that's a real gift.
It is the coziest nap.
Yeah.
I could not agree more. And I really want my listeners to hear you say that. And I've even heard you say too, like, I love when you kind of guilt trip people and say, like, it's selfish of you to not get it.
It is. I mean, listen, if you care about the people in your life, it is so, it's an act of love, and it's really unselfish to say, I want to rule out this cancer because I want to be around for a long time for you.
Yeah.
For your children, for your partner, for your parents.
Yes.
To take care of them. And so it is the ultimate selfless act to get screened for colon cancer and get screened for other cancers as well. Do you mind me asking what kind of cancer your parents
My
had?
My mom had brain cancer in her 50s, and then my father had esophageal. So
how old were they when they?
My mom was only 57.
Oh gosh.
And my father was 87. But it was really interesting. They were both treated here. They had really incredible physicians, but there's not a screening test for brain cancer.
Glioblastoma is one of those cancers that is so heartbreaking. I mean, they all are heartbreaking.
I know, they really are.
But I know people who have been diagnosed with glioblastoma, and I'm really hoping and praying that science is going to help us with new treatments for this very, very difficult cancer. I'm hoping immunotherapy. more targeted therapies, and all the advances. We're at this incredible inflection point for cancer research where we have AI, which is going to be infinitely helpful in diagnostic techniques, right? And then you have immunotherapy, which is really proving to be so exciting.
It's incredible.
And all kinds of discoveries. And now is not the time, we won't get political, to pull federal funding for cancer research, but it also shows how important these academic institutions like UCLA are. You know, I've been heartbroken. I'm going to interview Francis Collins about this, the former head of the NIH, who just stepped down, about the role the government and academic institutions play in moving scientific research forward. And I think it's really important that people recognize this, that they understand the system and understand how the private public sector, how it's all connected. And if we want to make progress, we have to keep our foot on the gas. And now is not the time to reduce public funding for these scientists who are going to ultimately save so many lives, and not just for cancer, but all kinds of diseases.
So many lives. We are frankly quite worried. I will tell you too, Dr. Linda Liao, who's the chair of our neurosurgery department here, she operated on my mom, and she still has her brain tissue in her lab as she's working to develop a vaccine.
Right, and vaccines, I think, are such an exciting area. I'm glad you brought that up.
Yeah.
And it's great that she kept it. You know, I went back to New York Hospital where Jay was treated to find his tissue samples so we could analyze the DNA for my daughter.
Right.
And, you know, Ellie got a colonoscopy, by the way. I want your listeners and viewers to understand that if you have a first-line relative, like your mother, your father, a sister, brother, an aunt, uncle too, who was diagnosed with colon cancer, you need to get screened 10 years before that person was diagnosed. So Jay was diagnosed at 41. Ellie needed one at 31. And, you know, and I also think there are a lot of people, please urge your listeners to, and maybe you'll do a whole podcast on this, because I don't think people understand the importance of genetic testing.
Yes, we will.
I think that they think it's cost prohibitive.
And they think it's for something really esoteric.
Right. And they're also afraid of it. They're like, I don't want to know. But it is so important to know if you have a genetic predisposition, because then you can actually take steps to get screened or to change your lifestyle or to figure out ways to prevent these diseases. I was screened, and I actually have a gene that will slightly increase my risk of colon cancer. And I'm like, are you serious? But, you know, which of course makes me more concerned for my daughters. But my mom's family is Jewish, and I have the Ashkenazi Jew gene, which I think, and do you know which gene shows a more likelihood, a slight risk? I forget the one.
I don't remember.
I forget the one it's called, but it's really, really important to get genetic testing.
It's information. You know, in the same way, I think even when we're talking about screening and diagnosis, it's information about your body. I really don't want people to be afraid of information about their body.
Right. And I think people need to be much more educated, and genetic testing needs to be much more accessible. You know, as an internist, I hope you talk to your patients about that.
Constantly. And I promise you we'll do an episode on genetic testing.
Okay, good. Because I don't think people like, okay, where do I go? Where do I, you know, what company do I do?
Oh, no. And what's the associated counseling, right? Because to your point, a lot of people don't want to know, or they might want to know, but a family member might kind of try to dissuade them.
Right.
So it really is. Sometimes it ends up being family counseling. What am I going to do with this information when I find out?
Right.
And we need to talk about that.
Right. And also I think you need to do it in a way where you update it, because new genes are being discovered every day, right?
Yes.
So I got genetic testing a while ago, and I will probably get it again in a year or two, because who knows what, you know, my dad had Parkinson's, for example. And I don't know if a gene associated with Parkinson's has been discovered. I should look into this. But I'd like to know. Well, would I like to know? That's the question, you know?
But
would I like to know?
It's different, right? I mean, it's a dynamic, evolving conversation with yourself, too.
Right.
You know, depending on the disease as well.
Right, exactly. You know, I remember reading about Huntington's disease. And that is such a devastating, debilitating disease. And I think it is kind of an ethical question. Do you or don't you want to know? But I think with some things like a colon cancer or breast cancer, especially with BRCA, 1 and 2, I mean, that increases your risk of breast cancer to, I think, 82% or something.
And ovarian.
And ovarian. So you should have the option. Do you want to have a prophylactic mastectomy and, hysterectomy? And sort of how do you figure out when you do that? So I think we need to appreciate the discoveries that have been made and figure out how to take advantage of that so you can live the longest life you want to live.
I could not agree more. And it's appreciating the discoveries that have been made and then acknowledging that there's going to be many more and that some we don't know about yet, which is, again, why it's so important to have a colon cancer screening, even if it's not in your family.
Definitely.
Something that always resonates with me from your talks, from your amazing book, going there, is how you've transformed grief into advocacy and I'll say sadness into action. How did, going back, did losing Jay shape your mission?
Well, I think anyone who loses someone they love to cancer, if you're a can-do person, you feel so helpless and so powerless. And cancer doesn't discriminate. It doesn't matter if you're educated. It doesn't matter if you're a TV anchor. It doesn't matter. It is the great equalizer among men and women. And I felt extraordinarily powerless when Jay was sick. I was doing so much research, Eve. I was looking up clinical trials. I was calling, pharmaceutical companies in Israel. I was combing the internet. And nothing I could do could save Jay and keep his cancer from ravaging his body. It's started in his liver. I knew, because of my connections, I called the head of the NCI and I became really friendly with the deputy director, a guy named Al Rapson. And I used to call him, he'd say, "Hello, Dr. Couric," because, I was studying so much. And so I felt so powerless and I did everything I could. So I think after Jay died, after 9 months, I thought, I have to do something. I have to honor him and his grit and determination to fight this disease. But since I couldn't save Jay, I had this platform and this bully pulpit. Perhaps I can educate and save other people. And I think it was incredibly cathartic for me to go from being helpless to being helpful. And it also helped my healing process. And not everyone has a platform like the Today Show, but you do have your own, private or personal platform where you can use social media now. It didn't exist when I was going through this. You can do things in your community. You can be an advocate. You can, you can raise money for research. So there's a lot of things you can do. And I've had friends who have lost loved ones to either colon cancer or other cancers or other diseases. And I firmly believe transforming your pain into purpose, which now sounds like such a cliche, it is absolutely essential to the healing process. And that's why I wanted to do what I've done. I knew it wouldn't bring Jay back, but I thought there are other people like Jay, who have a 2-year-old and a 6-year-old. And the idea of helping people see their children graduate from high school or play in a soccer game or be at that college graduation or walk a daughter down the aisle, all these things that Jay missed, maybe somebody else wouldn't if they were screened. And so that was what really galvanized me to do something and to not keep everything that happened to Jay private, to share, because I thought sharing would save lives, and I think it has.
I mean, it really has. I mean, and it's incredible. Thank you for sharing that, because it is really difficult. And I couldn't agree more about, just transforming and finding purpose in that. The whole reason I became a physician was because of my own illness. And that's what galvanized me to switch, from dancing to then taking all my science classes and becoming a physician, because, things change, right? And what matters changes. And then you really want to make a different sort of difference. I really love that what you say.
Yeah. Though, I'm so grateful for doctors like you and for people who go into medicine. I know how tough it is, and it gets tougher and tougher. And I think the system makes it incredibly challenging. But doctors, clinicians, scientists, researchers, people who have dedicated their lives to keeping people healthy and to seeing that they are there for their families and they can be productive citizens. I bow down to you. I do, because I'm so grateful, and it is really hard work. I've been watching the show called The Pit.
Oh, yeah. It's really, that's as real as it gets.
I want to interview Noah Wiley because I think he's so great, and I saw that he's writing a number of the episodes.
Yes.
Of course, he was in ER. I'm old enough to remember staying up late when I was on the Today Show to watch ER, especially because of George Clooney. I'm not going to lie. But talk about dedication and commitment and selflessness. I think doctors just are so high on my list. And I just want to express my gratitude to all of you out there who have devoted your lives to your patients and to the science that will ultimately help those patients.
Thank you so much for saying that. I mean, I'll say on behalf of all of my colleagues, I think we just feel really grateful to do it. And I do think, to your earlier comments about how important it is that science continues discovery and then translating that into the clinical space, meaning in the exam room with our patients, teaching others to do it. I mean, that's what's going to bring progress and propel us forward and save lives. And sometimes saving lives is just making your life better, even when you're struggling or suffering from something.
Right. And making things more manageable. I mean, I know that, and one of the goals is to treat cancer as a chronic disease.
Yes.
And to be able to manage the symptoms. But I'm an optimist and perhaps a bit of a Pollyanna, but I really want to visualize when we can eradicate cancers and, basically allow them to be cured. I know that's a audacious wish and claim and goal, but I really hope that it happens. Maybe not in my lifetime, but in my daughter's lifetimes.
I think that's exactly what we should wish for and plan for. I really do.
I hope so too. But anyway, kudos to all you people out there who are working on it.
Thank you so much. I just have a few other questions. If that's okay. I mean, I wanted to go back to the advocacy because it's true. I mean, one of the most amazing things you have done, and we're watching you do it every day, is use your incredible platform, your personality, and to share and make a difference. And you mentioned some of the things that, maybe private citizens can do in terms of volunteering and community. But I'd like to think that maybe there's an opportunity for us to be able to be advocates even with our friends and our family.
Definitely.
And so, I mean, is that just making sure that the information gets out there, that they, go on your, terrific media site and get great information and then share it with each other?
Yeah, definitely. I think, this should be, as we discussed earlier, not a taboo topic. It should be like, as simple as saying, how are we going to celebrate your birthday? Or it's your birthday, you're turning 45. And, I think it should just be a part of every family's conversation at Thanksgiving.
Yeah.
You can bring it up. Can we, before we go, Eve, can we also talk about breast cancer? Because I am on a breast cancer tear.
Please.
I'm all about dense breasts.
Yes, of course.
Can we talk about breasts?
We're going to have a whole episode on that as well, around imaging, the imaging and the dense breasts. But please.
Okay. Only because I personally experienced this. and I'd love to hear what you think about this, obviously, as a physician. A few years ago, I have dense breasts, and 42% of women 40 and over have dense breasts. Now, there are degrees of density,
yes,
from 1 to 4. I'm pretty sure I have pretty dense breasts. I don't know, my rating at this point. But because of that, I have always gotten a mammogram and an ultrasound. And so my breast radiologist a few years ago noticed some changes in my mammogram, and I got the ultrasound, and it confirmed that I had a suspicious area that was biopsied, and it ended up being breast cancer. Now, I think what people don't appreciate is that on a mammogram, sometimes it's hard to determine if you have breast cancer, because in dense breasts, the density looks white on a mammogram. The abnormality also looks white. So my doctor described it as trying to identify a snowball against a backdrop of snow.
Exactly.
And so I just want these 42% of women to talk to their radiologists and ask them if they should get an ultrasound. Now, some things have changed. I'm happy to report. The U.S. Preventive
Services Task Force. Yes, I know.
Like,
it's a
what
mouthful.
A cumbersome name.
Yes,
the Preventive Services Task Force.
You got it.
Okay. They now require women to be told,
yes,
if they have dense breasts, in no uncertain terms, after they get a mammogram. So that wasn't the case in a number of states, right?
No,
you were just basically told your mammogram's fine.
That's right.
You wouldn't know if you had dense breasts or not. So now they're required to say you have dense breasts and to talk to your doctor about it, right?
Yep, that's exactly right.
So I just wanted to make sure people are aware of this, because it's hard in this fragmented media landscape to get this kind of information out. And if I hadn't had an ultrasound to confirm, I also have a brilliant breast radiologist. I'm so grateful to Dr. Susan Drossman in New York City. But a lot of people get mammograms. They're given a clean bill of health, only to find later that they could not identify the mass when it was small. And then it grows and then has a chance to become a much more serious problem. Did I get all that right?
100%. And you're bringing up this point is if we're encouraging people to get screenings, we need them to feel that screening is accurate so that they have trust and will do it again, right? That it's the right screening test, that they're reassured, hopefully, by the results. So absolutely. And this is the Find It Early Act that you are championing.
Yes, it is. That would be would require insurance companies
finally
to pay for additional screening among women who have dense breasts. And because a lot of women are told you have dense breasts, you need additional screening, and they can't afford the ultrasound. And then it's a fight with their insurance company. I hope you do a whole podcast about this and insurance,
Absolutely.
Which is, I think, has become such a nightmare and such a important topic.
It's a barrier to healthcare.
Yeah, exactly. And so, not to mention, obviously, in underserved populations, Black women and Black patients, both for colon and breast cancer, have a higher incidence of both and a higher mortality rate. I think Black women are 50% more likely to die, 40 to 50% higher mortality rate from breast cancer. And that's because they're looking at biological factors that may make breast cancer more deadly among Black women, but it's also because they don't have access to screening, and it's being discovered later and later. So there's so many things to talk about, and this is so important. And these barriers to healthcare and accessibility is something I care deeply about. My breast cancer surgeon, Dr. Lisa Newman of New York Hospital, I adore her. She's doing so much important work with health disparities. And I said to her when I was being treated, Dr. Newman, I feel so lucky that I have access to you, to all this medical technology, to this equipment, and that so many women don't. And it's just unfair, and it's just wrong. And so we have to do something to make sure that everyone has access to the screening and diagnostic tools that people of means have.
I mean, I couldn't agree more. This is something that we're working on fervently here at UCLA Health, and I'm sure many other academic medical centers as well. But that is that notion of luck. I mean, I've been thinking about this since I read it and I heard you speaking about it. I mean, we want to say early detection as a matter of luck, or good fortune, but we do need to shift the conversation so that everyone sees early screening as a fundamental right. It's not just a privilege. So,
but right now it's a privilege.
But it's a privilege. And getting that second test, you know?
And I think it's a question of education.
It certainly
Obviously, it's a question of financial means, and it's a question of insurance coverage and so many factors. And how are you doing that at UCLA? How are you going to people who may not have access to these tests or may not that they should trust?
That's right.
Not only scientists and doctors, but journalists too.
How do we then sort of transition this to making sure people get their care? Well, let's make sure that they actually are health literate or have any sort of semblance of health literacy, that information given to them is in the language that they actually speak. If we're sending them home information that goes to a patient portal, well, that's electronic. Maybe they need things printed out because they don't have a device.
Right.
So it's just taking into this, a whole person perspective about caring for people and acknowledging that, this person isn't just like me.
And how do you do follow-ups? It's one thing to give people the information they need, but it's another thing to translate that from education to action.
Absolutely. And that's the ongoing challenge, but we invest in a whole social work and what's called a care management structure of social workers, nurses, medical assistants, to help people and support them. Because so much of medicine isn't just in the exam room. Right?
Right.
So much is making sure they get their medication. It's making sure they have their education. It's making sure they know how to take the medication, not just going to the pharmacy.
Right.
So it's recognizing that the doctor-patient interaction in an exam room does not encompass the entire medical experience or your care continuum.
What do you do if you talk to somebody and they're 52 and they need a colonoscopy, right?
Yes.
Or they need colon cancer screening? Who pays for that? I mean, I guess you have Medicaid and Medicare, obviously, Medicare for people who are 65 and over, right? But let's say somebody just doesn't have the means or they're out of work, but they really need to get screened. What do you do?
We have a lot of relationships with community hospitals. We do a lot of our own work that ends up not being reimbursed, but we connect with a lot of grants and other organizations and a lot of philanthropy to make sure that we're screening, our community. During COVID, the whole county was very backed up on colonoscopies. So we just, formed a fast track basically for county patients who were underserved and underinsured so they could just fast track to our doctors to get screened.
Yeah. And of course, then you have to convince them that it's something they need to do.
That's exactly right. Nothing is ever just a one and done.
Right.
And that's where the relationship comes in. And I'm going to just ask one more question. And it's just, sorry, everybody.
No, go.
I'm like, you're here.
No,
but,
you can. I'm fine.
But one of the things
I do all the time in the world. I can just talk for hours here.
Look, I don't want to go to lunch. But, one of the things when I was reading your amazing book was you did comment that Jay didn't have a primary care doctor.
No, that's something I feel so guilty about, in retrospect. He was, working hard. He was a lawyer. We had 2 little kids. And now I can't believe that he wasn't going to get yearly physicals. I think that back then people went to a doctor if they weren't feeling well. And I think because most women are part of the healthcare system because of reproductive reasons. So they go to the gynecologist or they go to their OBGYN or whatever. But Jay did not have a primary care physician. And the fact that I didn't talk to him about that, I feel terrible.
It's amazing that you're taking it upon yourself to feel badly. I mean, I think this is a message I try to get out to everyone, which is, as a primary care doctor myself, which is, everyone needs a primary care doctor. This is your general internist, the same way you had a pediatrician that you went to, until you were 18 and got your vaccines and checked your eyes and ears. Grown-ups, 18 and older, you need that too. And have that person be your quarterback. I mean, so much of what I do is just listen to people, know them for a while, so I can say, wow, what's going on this year that's different than last year? Or, you're looking a little bit different.
But how hard is that for you maybe you're a different case, but so many doctors have so little time with their patients. That's one of the things I'm very excited about. What do you call them? The health records, computerized.
Electronic health records.
Thank you. Electronic health records is that, because I have 5 or 6 doctors in New York.
Yes.
And I'm like, hey, why aren't you guys talking to each other? Why don't you know, so you don't have to go through this whole thing every time. And why doesn't my gynecologist know something that my oncologist is telling me? And it's so crazy, and it's taken so long to get these electronic health records
to be integrated.
Yes. It's making me crazy.
It should make you crazy, but it's getting better.
But I think that is really important because doctors have a limited amount of time with their patients. Yes. You hear that all the time.
Yes.
Like, how much can I get into in 15 or 20 minutes? And I think that will really help them because they can look at that. They don't have to waste their time asking too many questions, and then they can move forward with the information they have in front of them.
Absolutely. And forging those relationships, and right. really getting into it. One of my favorite things about being a doctor is that there's not really small talk. I could just get to talk to you, and ask you. And I love hearing about my patients' families, what they're doing, what they're worried about. And when you know someone for a long time, when they come in and then they say, gosh, please refer me to, a gastroenterologist, I'm having a stomach ache, I can step back and say, what else is going on? Like, let's talk about that. And then often they're anxious. It has nothing to do with their stomach.
Right.
But no, we are pressed for time. But at the same time, you're right. The EHR, the electronic health record, helps immensely. I mean, I hope it helps you as a patient because I can then synthesize all of your records and say, listen, I'm caught up. I saw your dermatologist. You got your mole check. I see that you got your colonoscopy. You're up to date on all these things. And then I can really focus on you.
What's taking so long to get their act together?
We have it here at UCLA. I mean, I trained at Columbia. You're right. So it was a little bit different. But here in Los Angeles, no matter what health system you're in, whether it's UCLA, Providence, Cedars-Sinai, we actually have something called Care Everywhere. So I can see, even if you're at another health system.
Really?
Yeah, your imaging, your blood work. And I mean, that's healthcare. That's a continuity of care. That's coordinated care, and that's a better quality of care.
Exactly. Well, please talk to my doctors in New York.
I'll call New York. I don't want to keep you anymore, but before you go, I mean, I'd love for you to share with our medically speaking audience and listeners, what are 3 key messages that you want us all to remember?
Well, obviously, get screened, understand screening guidelines, and talk to your doctor, and don't put it off. I've heard cases of somebody who got metastatic colon cancer at 52 and have said things like, if I had gotten screened at 50, it would have made a world of difference. So really the guidelines are there for a reason. Mm-hmm. Pay attention. Don't put it off. Act now. Get it taken care of. It's not a big deal. Don't be a baby. So that's number 1, I guess. Number 2, I guess is try to do things that will keep you in good health. A lot of the recommendations to stave off cancer will help you with heart disease. They're all kind of there's an intersection with these things that you can do to keep yourself healthy and well. So, and by the way, I don't practice what I preach sometimes. Like, I love chocolate chip cookies, and I probably eat too many chocolate chip cookies. And, I have a real sweet tooth. And, I like a big, fat, juicy cheeseburger. But, everything in moderation. I don't think you have to go crazy, but try to exercise, move your body, mm-hmm. and pay attention to science as it, you can't go crazy because every day there's a new study, right?
Yes.
But I think it's important to look at things and kind of say, well, that's interesting. Should I be following that path? You know,
Of course.
I don't know, but that's a fine line, isn't it, Eve? Because you could drive yourself crazy. Like oat milk is great. No, oat milk isn't great. You know, every day there seems to, but I think if you use common sense.
Yes. Be judicious with your, you know, energies.
Right. And try to have a healthy lifestyle as best you can.
I agree.
You feel better, you look better, and you know, you're taking care of your insides as well as your outside. And I guess the last thing to me is, I think, goes with sort of my advocacy work. I think the best route to happiness is serving others in some capacity, whether you're a doctor, whether you're just helping an elderly neighbor get her groceries, or you're, you know, doing something for a family, you know. I mean, there's so many ways to give back. And I think sometimes that Arthur Brooks and Laurie Santos and all these happiness experts, I think it really does come down to seeing outside of yourself and figuring out, what can you contribute? I know there's this wonderful Ralph Waldo Emerson quote.
We want to hear you say it.
Okay. I love this Ralph Waldo Emerson quote. And it's kind of, to me, the key to living a happy, successful life. He wrote, "To laugh often and much, to win the respect of the intelligent people and the affection of children, to earn the appreciation of honest critics and endure the betrayal of false friends." Oh, that's pretty dark, Ralph. Anyway, to appreciate the beauty, to find the beauty in others, to leave the world a bit better, whether by a healthy child, a garden patch, or a redeemed social condition, to know that one life has breathed easier because you lived here. This is to have succeeded. So I think, you know, I think that is such a great recipe for a happy and full life. So I guess for me, it has certainly been incredibly gratifying to know that through such personal pain, I have alleviated some pain in some other people. It has made me feel fulfilled and satisfied in a way I think I otherwise wouldn't. So I guess those are the three messages. Get screened, live healthy, and help others.
Katie, I just can't thank you enough for being here today. We're all so deeply grateful, and hearing Ralph Waldo Emerson's words coming from your mouth to everyone's ears. I mean, your work, you know, has saved lives, but I really, truly feel that your voice truly inspires being alive and living.
Oh, thank you, Eve. Before we go, can I also just give one little pitch to Stand Up to Cancer?
Of course.
I've had 2 meetings the last 2 days, and it's such an important organization. And we're doing such important work that I just want people to understand kind of the reason Stand Up to Cancer was created.
Absolutely. I think you co-founded it with she was a regent, but she's on our Sherry Lansing.
Yeah. So I've seen the last 2 days.
Yes.
And Sherry and Laura Ziskin, who passed away from breast cancer, and the 9 women in all who really wanted to change the face of cancer and how cancer research was conducted. And our idea was really the key to finding cures and making progress in the fight against cancer is collaboration.
Yes.
And I found when I was doing a lot of research about colon cancer when Jay was sick, it was really siloed. And we thought if 2 heads are better than 1, 10 heads are better than 2. And if scientists could get together and share their brain power and their research and their tissue samples and their incredible intellectual prowess and collaborate, we would come up with better science and better treatments and ultimately one day a cure. And our research has contributed to FDA-approved drugs, and the scientists love working with each other from different institutions or pharmaceutical companies or academic centers. And I am so proud of what we've done with Stand Up to Cancer, and so appreciative of UCLA's support and interest in what we're doing. And, it's just been one of my proudest accomplishments, that and getting colon cancer screenings increased by 20% following my colonoscopy. I mean, they, other than my daughters, really are my proudest accomplishments. So thank you for letting me take a moment to crow about Stand Up to Cancer.
You should never stop crowing. And the Couric effect is, as I said, I mean, it has saved lives. And Stand Up to Cancer is an incredible organization. And the Find It Early, these are all making such a difference in everyone's life. But it's saving lives, but also making your life better. I mean, listen, we might get something detected early. We might suffer. We might have to, have a surgery. But that early detection, the screening, investing in our science and research will make our lives better too, along the way.
Yeah, and just educating people.
Yes.
So thank you for doing this podcast, and thank you for having me on.
Well, I'm going to ask you one other question then. Sorry, since one other question. We are just launching this podcast, and you're one of our first guests. And do you have any advice for us moving forward in terms of how to get out the amazing work that, really my colleagues, everyone at UCLA Health does? Then I'll let you go, I promise.
No worries. I think, first of all, just doing it is critically important. I think that there is often a disconnect between science and lay people in terms of really understanding things. So my advice would be to get people to really boil it down to a, 8th grade level.
Yes.
I need that for a lot of subjects. I happen to be extremely well versed on colorectal cancer, but still a lot has changed since Jay passed away, and I need to constantly continue to educate myself. So I think to help people understand in clear terms, even visualizing the colon as I did is like this packaging, or just talking about things and talking about new therapies, to talk about what is immunotherapy? Why does it work? What are some of the challenges of immunotherapy with, like, if you boost the immune system too much, and why it's such a delicate balance? And to just get people to explain in simple terms, kind of medical jargon. I think doctors get into a world of medicine and they think everybody went to med school. And they didn't. And so I think if you can help people understand these issues and conditions and treatments and screening techniques, you will be doing such a service to people, because you will be able to give people the information they need to take action and save their lives or make their lives better.
Thank you so much for that advice. That is 100% will be our mission. Katie, thank you for being here today. And thanks for just spending all this time with us.
Of course. I mean,
a thrill of a lifetime.
A lot of times I'm talking to scientists and I'm like, whoa. Wait. I don't understand a word you said.
That's Annie's role. She will hold up a sign that says break it down.
Okay, good.
But that's exactly right. We really feel like you should not have to go to medical school to know how your body works and how to take care of it.
Definitely.
I mean, this information should be accessible to everybody.
Absolutely. So I hope at least one person listening to our conversation will call their doctor today.
Yeah.
And make an appointment to get screened.
And even just to talk about it.
Yeah, definitely. Right. And tell two friends, and they'll tell two friends, like that Fabergé wheat germ shampoo commercial, which nobody is old enough to remember in this room. But, it can have a ripple effect. If you become an advocate, even for a few people, and you tell them to tell someone else, think of how much you could change the world.
Well, you have. Katie, thank you.
You're welcome. It was so fun.
Oh my gosh.
And by the way, you did a great job.
First podcast.